I want to give you the update from the state health department. 49 people have now died from the coronavirus here in Indiana. That's a big jump from yesterday. There's more than 2,100 positive cases in our state. Over 13,000 people have now been tested. Now, the peak of the coronavirus here in Indiana is not expected until sometime between mid and late April. Governor Holcomb said today it could be a while before life gets back to normal.
But what we don't want to do is be premature about just reflexively jumping back after we hit that peak and come down and appear to be, because you've seen around the world where it'll slope back up again. So the numbers that I'm looking at is on a gradual, methodical way of we'll always be in this new normal. Things will be different going forward for obvious reasons.
Governor Holcomb and state leaders will be giving updates twice a day instead of just one to keep all of us up to speed on what's happening. Well, the United States has now more coronavirus deaths than China, where that pandemic started. More than 3,500 people across our country have died from coronavirus, topping China's death toll of 3,300. New York is the hardest hit, 300 deaths in just one day alone. But White House health advisor Dr. Anthony Fauci says he sees glimmers that social distancing efforts to slow the spread are now beginning to dampen the outbreak.
And we learned today from IFD that 12 of their firefighters now have tested positive for COVID-19. Those firefighters right now at this hour are in home quarantine and will not return to work until they have been medically cleared. Now, other firefighters who may have contact with those 12 firefighters who tested positive will now take advantage of Eli Lilly's testing program for the virus. IFD can't determine right now whether or not the cases are connected, but do say that the firefighters that are positive, all 12 of them, are not from the same fire station. Also, the Marion County Sheriff's Department say they now have 5 employees that also have tested positive for COVID-19, including a jail deputy and also a courthouse deputy. And how about in Fishers in Hamilton County? That's where firefighters and paramedics now are utilizing what are called reusable masks for their medical runs. Now, when they arrive on the scene, they are wearing masks, gloves, and glasses, and they look a little bit like this. All 135 firefighters and responders have plastic masks. These masks have disposable cartridges. Before the crews enter the home, they will pass in a hospital mask for the prospective patient to wear as well. Additionally, the Fishers team also has a full gown protocol, and this is what they will use at the scene if people, when they arrive there, do have COVID-19 symptoms.
And as you just heard, we're getting our first look tonight at the level of coronavirus infections among local first responders and healthcare workers. Now, according to new data released for the first time by Eli Lilly, as many as 300 or more have now tested positive for COVID-19. 13 Investigates reporter Sandra Chapman shows us tonight what Lilly found after just 2 weeks of testing.
Frontline workers in Indiana moved to the front of the line for COVID-19 testing when Lilly stepped up to provide critical support less than 2 weeks ago. Now, for the first time, Hoosiers are getting a look at the impact of in-state testing for the sickest among us and for healthcare workers and first responders. Since March 19th, Lilly has run 6,000 tests for the Indiana State Department of Health. Nearly 3,000 of those tests, or half of them, were for inpatients at Indiana hospitals needing emergent results. The other half came from Lilly's Drive-Thru testing initiative for frontline workers. That testing started with doctors, nurses, pharmacists, and others working in healthcare settings. A day later, the testing was expanded to include public safety, fire, and EMS crews from Indianapolis. According to Lilly, 10 to 15% of those combined tests came back positive for COVID-19. That means a little more than 300 workers on the front lines have already been infected by the coronavirus. A Lilly spokeswoman tells 13 Investigates that of the thousands of tests processed, none have been lost. But in a few rare cases, a test was not able to be evaluated due to an inadequate specimen, a cracked tube, or a technical issue with the diagnostics. That was less than 0.2% of cases. While the goal for processing is 24 hours, the turnaround time is between 24 and 72 hours. Lilly says it's doing everything possible to push out results as quickly as possible. Back to you.
To Boone County now, where there are 22 confirmed cases of COVID-19. The Witham hospital officials and public health officials there right now are bracing for the worst. Rich Van Wyk found an overflow hospital now is prepped and ready there to take in patients if needed.
Witham Hospital in Boone County, like many other hospitals in the state, are preparing for what a few weeks ago was the unthinkable. President and CEO Dr. Ray Ingham.
Well, we think we're pretty well prepared. That being said, what are you preparing for? We don't have any concept of what could happen.
Ingham says the hospital increased its available beds by almost a third to 100 and expanded the capacity of its ICU. But even those changes may not be enough.
We think that we will probably double, if not triple, our ICU and probably have to expand into the community over at the fairgrounds.
At the county fairgrounds, workers have prepared one of the biggest buildings to become an overflow hospital. There's room for 100 beds and the ability to expand into other buildings. The so-called hospital of last resort can be ready for patients with 36 hours notice.
Well, I mean, it certainly won't be as pleasant as being in a hospital, but it'll be where they can get good medical treatment.
But Ingham worries about having enough staff and having enough personal protection equipment to keep the doctors and nurses healthy.
The third thing that I worry about is an overextension of my team to the point where they dedicate themselves and they become sick.
The community is responding to pleas for help. Dentists, even painters, have donated scarce PPE to keep the healthcare workers healthy.
We learned today that CNN anchor Chris Cuomo announcing on Twitter that he now has been diagnosed with COVID-19. Cuomo says he feels good and he is now quarantined in his basement. He plans to continue to anchor his show. It's at 9 o'clock at night. He'll do so from his home. Now, Chris Cuomo happens to be the brother of the governor of New York, who is Andrew Cuomo. Small business owners who are eager for federal SBA loans are facing challenges, and you know what? They're getting really frustrated right now. For example, one of those people is Brian Zajac. He just opened and then had to close a new home store. He says he's since spent countless hours waiting online, also waiting on the phone, because he's desperately been trying to get information on the status of his application. He a video here that his daughter shot. At one point, look at the number. There were 1,400 callers ahead of him. Last night, gratefully, he says he finally got through.
Everybody's going through this right now. I understand that. I'm not trying to lose patience or anything, but we need some answers, and we need the help now.
Brian says he's pursuing all sources. He just applied for a loan through the city and the chamber's new program, which he called that process, in comparison, very simple.
Well, COVID-19 has forced funeral homes to change the way they're helping families at their most heartbreaking times. Our Steve Jefferson is working from home tonight, where he's been in contact with a family who used technology to celebrate their loved one's life.
Local funeral homes are staying in compliance with social distancing, and technology allows them to keep families safe as they say goodbye to their loved ones.
I was able to say goodbye in the comfort of my home, and that done me good.
When I talked to Callie Sanders over Zoom Tuesday afternoon, you could tell just how grateful she is about being able to see her cousin's homegoing services.
I had medical challenges, so does my mom, so we weren't able to go.
Sanders' cousin, 69-year-old Gil Journey, was like a brother to Callie. When Bluewood and Sons Funeral Home arranged live streaming of Journey's celebration of life, it not only allowed more attendees, but kept his own staff safe. Nathan Bluewood shared since they only allow 10 people inside at a time, they made changes so others can say final farewell.
We actually come into the community of the deceased, go past his home, all the neighbors were out to give that love that is usually extended in a funeral.
With Indy's COVID-19 future still unknown, both Blewett and Callie Sanders shared this message for the entire state.
I just want everybody just really take this serious because this is no joke. People are dying every day. And I just saw in the news where Marion County has been hit really bad.
And the best part of the live funeral streaming is the fact that Callie and her family will be able to go back and watch that video anytime they want.
Steve, thanks. Let's turn our attention